analysing the cost-effectiveness of hygiene promotion interventions.
Well, it's very important that what we do contributes to building an evidence base for the cost effectiveness of hygiene promotion through water and sanitation related services. It's much more common for people to understand how to cost pumps and pipes, but not so easy to cost software interventions like hygiene promotion, which is really aimed at improving health through better hygiene practices, through behaviour change. And I mean, historically in the sector, that sort of thing has been very difficult to measure. And in the last year, as you know, I mean, WASHCost has focused on the costing of services, of water and sanitation services. Very difficult to conceive of hygiene promotion as a service led by a single department in any kind of coordinated fashion. So very often hygiene promotion is something that is led through the water and sanitation project. Rather than trying to understand hygiene services in an integrated, coordinated way, we are focusing on the cost effectiveness of hygiene promotion interventions. So we're looking very much at comparing behaviours, three key behaviours, before and after interventions, but also comparing types of intervention with each other across countries. We've had a close look at the existing literature and research on hygiene promotion and the three key behaviours that it tries to change in target groups. And the one, of course, is hand washing with a soap or substitute at critical moments. Two of those critical moments being after defecation and before preparing food. The other one being the use of a sanitary latrine, and the other one being the use of the safe use of protected and safe water at household level. So household water management is a critical indicator that we've looked at. We'll do them in all the WASHCost focus countries. I mean, there is no really good district health system in place in any of the WASHCost focus countries, so we're looking at hygiene promotion interventions in those countries. But in Ghana, in Mozambique, district-wide, 128 districts, in Burkina Faso through the Faso program, as well as in Andhra Pradesh. All of these interventions aim to change those behaviours, those three key behaviours in one way or another. I suppose the kinds of methodologies would be traditional approaches to hygiene promotion like FAST and PRA and those sort of participatory approaches. Community-led approaches like community-led total sanitation or total sanitation campaigns. And then in Mozambique we have an approach called PEC Zonal, which is a sort of district-wide community participation approach. The end result will be a measure of the effectiveness of those interventions and the costs of those interventions. So essentially a cost effectiveness analysis of interventions within those countries and of comparisons between those interventions.